I always had what we call the Carlin nose. I had the same nose as 6 of my brothers, and it was not a woman's nose, it was my brother's nose.
Well, when I first met Diane, her primary concern was she didn't like her nose. She thought that her nose was relatively big compared to her other facial structures. It was pretty obvious on examining her that part of her problem was that her chin was too small. And another problem was that her chin was de-emphasized by some fat that she had in her neck. And in addition to that, her brows had sagged, which is a normal part of aging. So as we talked to Diane and discussed her concerns, it became very evident, especially with the computer, that all those things together would accomplish her goals.
When I saw the computer images, I was like, oh my God, I have to have this done now. And I even said, can you get me in tomorrow? I want this done next week.
I think a lot of times your discussion with them brings on a lot of the different expectations, but then seeing it in front of you on the screen really makes the difference of giving that last visual endpoint of whether or not that's possible.
As I've aged, I've noticed the sagging in my skin and the right through here in my face. And I've always had dark circles under my eyes because of allergies.
Patty, on the other hand, was kind of typical of some of our patients that is slow to think about her concerns and takes some time. I initially had seen Patty in January of 2003, and at that time she was concerned primarily about her face. We discussed facelift, we discussed eyelid surgery, and then Patty went home to think about it. And about a year later she returns, and this time she's now concerned about her abdomen. She stated that, you know, I had several babies, my abdomen hasn't been quite the same since that time period, and what can you do for there? And she also had a little irregularity on her hips and thighs. So consequently, we reviewed all those options. She went home to think about it some more. Then she came back to see me again. She says, can you do it all at one time? And because I'm interested, I have concerns in both areas. And we discussed the surgery of this magnitude being difficult to do by oneself. And so she agreed that to do everything at one time with the assistance of Dr. Edney in this case.
One of the nice parts about our practice is we operate together every day. So each one of us knows the nuances of the other surgeon. We pretty much agree on the operations we're going to do, and I think it works really well when you have a team that operates every day.
I've always tried to do everything I could to make myself look better. It's just not knowing exactly what I need to do. You know, information is very important in finding out how you can look better. And if you go to the right person, it makes a world of difference too. And I think we've done that.
I guess I had very high expectations. I really had hoped that things would turn out. You know, seeing the before and after, you just can't, you can see the difference immediately during your consultation.
We delivered what we thought we could deliver by using computer imaging as an educational tool, and I think as a result she's a much happier patient.
And always with cosmetic surgery needs to be that this is going to be safe for that patient. We can't offer them a wide range of things to do if we don't think that they are going to be physically fit to go through it.
If this was our family, where do we want them operated on, and who do we want to operate on them? And so we do want safety, we want training, we want legitimate certification, we want the best team, and we want people focused on getting the best result for that patient and doing the right thing for them.
A clinic staff that is second to none. I think it's a very unique environment to receive plastic surgical care, and I think that explains why we get people from all over this part of the country coming here.
They asked me if I needed this for my confidence, and if I needed to be prettier for that, or what did I want to change? Was it to boost my ego, my confidence? And I said, no. I said, I think I'm a 10. It's just when I look in the mirror, I'm only a 5. So if we can get the mirror to make me look like I'm a 10, I'll be much happier. And I look pretty good.